I'm Dr. Jordan Reich, general dentist practicing at Arch Dental in Manhattan, down on Bleecker Street in New York City. The first time I heard about AI was my hygienist Sarah was at a course where they were talking about kind of new trends in dentistry, what's on the horizons, what's to look out for. She said, "Hey doc, what is this?" So VideaHealth has been able to allow me to take an objective look from the computer, and then I'm able to go into an exam room going, hey, I need to have my antenna up a little bit more than maybe I would if I was just running through my day without seeing the software first. So I'm utilizing it as sort of a preheat for me before I go into my exam rooms. So I have a general sense of, hey, is the computer seeing something just right off the bat that I should be looking for? What I've also now been doing is after I do my exams, I go back and I re-look at my AI, and it helps me calibrate myself. There are times where I miss things. Every dentist out there listening to me right now knows the feeling of, oh, is that really there? Is it an artifact? Should I open it? Shouldn't I? I feel really happy that I had another set of eyes catching something that might have gone missed and gotten worse for my patient. When we got a patient who's sort of on that borderline of, oh wow, there's some inflammation going on, there's some 4s, there's some 5s. What do? Having an objective set that's calibrated through math and science and all these fun things helps us feel more confident in our diagnosis. And when we feel confident, we're able to transmit that to our patients when we communicate with them. So now it's not us saying, hey, maybe you should do some periodontal treatment so this doesn't get worse. It's, hey, we know you have active disease going on. We know how to treat this and get rid of it and keep you from getting it in the future. This is what you need, let's do this. Right now it seems that we're utilizing it much more from our own clinical, increasing our diagnostic confidence, and then we're transmitting that confidence in our normal kind of conversation that we have with the patients. There's been times where it's looked at a filling that I've done in the past and said, hey doc, you might want to look at this, or an open margin on a crown that is mine, and it made me look at my dentistry even closer, which I don't take as a bad thing. I take that as just me improving myself every day. You're the doctor, you always will be. And this is to help you or me or anyone utilizing the software. It is not to replace you. If anything, it's making me more on point rather than just dependent on the software. So far, my experience with them has been great, and it seems to be an ongoing process. So they're looking for what can we do as a company do better for dentists, and I'm able to give my input, and I do feel heard. So that's been a really comforting thing for me. It's a wow factor still in our office.